Today, when something hurts, you probably imagine a very normal path: a pharmacy, a doctor, a small white pill, a clean bandage, a screen with test results, maybe a quiet room where machines blink beside a bed. Even fear has a system now. If you cut your hand, get a fever, break a bone, or feel a strange pain in your chest, modern life gives the problem a place to go. But for most of human history, there was no hospital waiting beyond the hill. There was no ambulance, no antibiotic, no painkiller in a plastic bottle, no x-ray, no surgeon in a bright room, and no one who could promise that the body would be fixed. So how did ancient humans survive without medicine? The honest answer is uncomfortable. Many did not. A small infection could become deadly. A broken leg could turn into a slow sentence. A bad tooth could become a whole body problem. A difficult birth, a deep wound, a poisonous bite, or dirty water could end a life that today might be saved by something sitting in a drawer. Ancient life was not secretly easy. It was not a natural wellness retreat with better sunlight. It was a world where the body had to survive with almost no backup plan. But that is also what makes the question strange. Because humans did survive. Not every person, not every wound, not every winter, but enough people survived for us to be here. They survived because medicine did not begin with hospitals. It began with paying attention. Before there were pills, there were eyes watching a wound. Before there were clinics, there were hands holding someone still. Before there were medical charts, there was memory. Which plant made a stomach worse? Which leaf cooled the skin? Which water made people sick? Which path had snakes? Which place was safe to sleep? Ancient humans did not have modern medicine, but they were not doing nothing. They were doing the first version of healthcare, made from observation, touch, fire, plants, rest, food, and other people. The first medicine was probably avoidance. The best way to survive an injury was not to get one in the first place, which sounds obvious until you remember what their world looked like. Every day involved sharp stone, fire, thorns, animal teeth, steep ground, cold nights, smoke, hunger, and long walking. A person who could read danger early had a better chance than a person who had to heal from it later. So survival depended on tiny decisions. Do not drink from that pool. Do not step there. Do not chase that animal too far. Do not sleep away from the fire. Do not ignore the smell of rot. Do not let a child wander near the edge. A lot of ancient medicine happened before the wound happened. It was knowledge passed through fear, mistakes, stories, and the simple fact that dead people cannot explain what went wrong. When injuries did happen, the body itself did much of the work. Blood clotted, skin closed, bones slowly repaired. Fever fought infection. Pain forced rest. The body was not helpless, but it was also not invincible. Ancient humans had to help the body do what it already wanted to do. Keep the wound cleaner, keep the person warm, keep them fed, keep flies away, keep them from walking too soon, keep them alive one more night. That sounds simple, but in a world without stored food or soft beds, keeping someone alive while they could not hunt, gather, walk, or carry anything was a serious act. This is where the group mattered. A lone injured human was fragile. An injured human inside a group had a chance. Someone could bring water. Someone could share food. Someone could carry firewood. Someone could watch for predators while the hurt person slept. Someone could remember that this person had helped them before. Survival was not just inside the body. Survival was around the body. Some of the most powerful evidence for ancient care is not a perfect tool or a written medical book. It is a skeleton that lived longer than it should have. In some prehistoric remains, researchers find healed injuries, missing limbs, damaged bones, or disabilities that a person survived for years. A healed bone is not just a bone. It can be a quiet sign that someone had time, food, protection, and help. One famous Neanderthal from Shanidar Cave survived serious impairments, and researchers have long discussed what that may suggest about care inside ancient groups. We cannot turn every bone into a sentimental story, but survival with severe injury often raises a simple question: who helped? A more dramatic case comes from Borneo, where researchers reported a young person whose lower leg had been amputated around 31,000 years ago, and who survived for years afterward. That does not mean Stone Age people had hospitals. It means some ancient humans may have had more practical knowledge, skill, and group care than we once imagined. Most injuries, though, were probably treated in less spectacular ways. A cut might be rinsed with water, covered with leaves, wrapped with fiber, held closed by pressure, or simply protected from dirt as much as possible. A broken limb might be rested, supported, or tied to something straight. A burn might be kept away from more heat. A sick child might be kept close to a caregiver and a fire. Nobody needed to know the word bacteria to notice that dirty wounds could smell bad, swell, and kill. Nobody needed a microscope to learn that some water made the group sick and some water did not. Ancient knowledge was practical because it had to be. It did not ask, what is the theory? It asked, did the person live? Plants were part of that world too, but probably not in the magical way people like to imagine. Ancient humans were surrounded by plants that could feed, soothe, poison, sting, numb, irritate, or heal in small ways. Over many generations, people could learn patterns. This bitter bark is dangerous. That leaf calms the skin. This smoke keeps insects away. That berry makes children vomit. This root should not be eaten. Some researchers have found evidence suggesting that Neanderthals and early humans used or consumed plants with possible medicinal properties. But the exact meaning is often debated, because eating a plant is not always the same as using medicine. Still, the bigger point is simple. Humans were pattern-seeking animals living inside a giant pharmacy and poison cabinet at the same time. The dangerous part was that the cabinet had no labels. Fire may have been one of the most important health tools ancient humans had, even if they did not think of it that way. Fire cooked food, warmed bodies, scared away animals, dried wet skin, hardened tools, and made night less dangerous. Cooking could make some foods easier to chew and digest. Warmth could protect the weak from cold. Smoke could be annoying, but it could also keep insects away from a sleeping place. Fire turned a patch of ground into something closer to a clinic, a kitchen, and a security system at once. Rest was another kind of medicine. Modern people often treat rest like laziness, but for an injured ancient human, rest could be the difference between healing and dying. The problem was that rest was expensive. If you rested, someone else might need to gather more, carry more, watch more, and worry more. So every recovery was also a social negotiation. Was the person worth the food? Was the wound survivable? Could the group afford to slow down? Did the group care enough to try? That sounds cold, but it is also human. Care has always lived next to cost. And then there was pain. Ancient humans could not erase pain the way modern medicine sometimes can. Pain was information, warning, punishment, and torture all at once. A person with a deep wound might not get a clean injection or a controlled dose. They might get pressure, stillness, bitter plants, smoke, distraction, sleep, ritual, and the presence of other people. Sometimes the treatment may have worked. Sometimes it may have done nothing. Sometimes it may have made things worse. Ancient medicine was a mixture of knowledge, luck, tradition, trial, and hope. That is why we should be careful not to romanticize it. Modern medicine is one of the greatest changes in human history. Antibiotics, surgery, vaccines, anesthesia, sanitation, imaging, and emergency care have saved lives ancient humans could not have saved. But we should also be careful not to imagine ancient humans as helpless. They noticed. They remembered. They taught. They adapted. They cared. The difference is that modern medicine often treats survival as a service. Ancient survival was a relationship. Your body belonged to the group in a way that modern bodies often do not. If you were sick, your weakness changed the day for everyone. If you were injured, your pain became a problem the camp had to organize around. There is something frightening about that because privacy was smaller and dependence was unavoidable. But there is also something deeply human about it. Ancient humans did not survive without medicine because they were tougher than us in some simple superhero way. They survived because their lives were built around constant attention to danger, constant learning from the land, and constant dependence on each other. The healer was not always one special person. Sometimes the healer was the whole camp, the person who knew plants, the person who carried water, the person who stayed awake, the person who held a child, the person who remembered what happened last time, the person who did not leave. Maybe that is the oldest medicine humans ever had. Not a pill, not a tool, not a hospital, but the decision to keep another body alive when that body could no longer protect itself. Modern medicine gave us miracles. It gave us clean rooms, numb pain, repaired bones, safe births, and extra years with people who would once have disappeared. But it also made survival feel private. You get sick, you enter a system, and the group can keep moving without you. Ancient life was harsher, shorter, and more dangerous. No one should wish for its pain back. But beneath all the dirt, fear, smoke, and broken bones, there was one thing modern life can still recognize. A human body has always been fragile. And sometimes the first cure was another human deciding that fragile bodies still mattered.